All right. Tyler Huston, welcome on the call. You're doing amazing things. I just wanted to check in with you and hear what you have been working on behind the scenes. Today is 2 months ago. It's the 1st of July. 2 months ago, you finished your instructor certification program in breathology. So I was just curious on how you have used it, how you have integrated it in your practice, maybe a little bit about your background and what you're working on right now.
Sure thing. Good to see you again, Stig. And happy Canada Day to everybody. It happens to be Canada Day today. It's where I'm coming from. 2 months ago, I finished my instructor's training in Vila, and an amazing experience that was. Returned home to Vancouver Island, and what I do is I'm an addictions nurse, and I'm also a paramedic, a first responder paramedic. And I was interested in the program to see the benefits and what I could possibly do, the potential for incorporating breathwork at the treatment facility that I work at to do what I can to relieve symptoms for PTSD, for addiction, non-pharmacologically. I'll put an asterisk at the end of that and 2 stars, that to take as many medications away as possible. And since I've returned, I've got a good jump on that, and we've started incorporating breatheology into our treatment center. I get to see patients every day, and they come down and talk to me in my office, and we're incorporating actually a breathing structured activity that'll run throughout the length of their patient's stay in a treatment center. And it helps with everything right from the beginning. When a patient comes into treatment, it helps. A lot of people are withdrawing, and it's an overwhelming situation coming into people everywhere, and it's a new feeling for everyone. So it helps them get grounded, stabilized, enter and become engaged in treatment process sooner. And once they're engaged, they're able to connect with each other. They can connect with their counselors because they have a higher self-confidence and self-awareness. They are able to tap into parts of themselves once they start breathing and start just kind of looking within. And when they start doing that with other patients and people around them, as a community, everyone gets more intertwined and tied in together. As they progress in their treatment, the breath holding comes into play, and that really acts as an amazing exposure therapy technique. So that makes patients it teaches them to become comfortable in potentially uncomfortable situations. And that's something also that they can throw in their back pocket, take with them as they walk out the doors into the community, and they can use as a relapse prevention tool, a support that they have with them and that they're able to activate when they need it the most. So that's what I've been trying to incorporate since I've returned from Denmark, and we're just kind of getting the ball rolling. But what I've already seen since I've got back, as I've seen the look in patients' eyes, I've seen the medications, the harmful psychiatric medications that have been removed already, and I'm seeing it make a real difference in their lives, and it's giving a lot of people their normal life back, and I've seen that happen already. Great. So thank you for letting me share that.
Well, thank you for sharing it, and thank you for being such a great role model, I would say, for becoming an instructor and then applying it immediately. I mean, for everyone maybe watching who has never heard about breathology or doesn't know what it is, it's 360-degree view on breathing, the entire breathing process. So the breathology method is a platform where you use breathing techniques, and as you mentioned, breath holding techniques. So for those interested in yoga, that would be pranayama. The other side of yoga that is not so well known, when you hold your breath, you access the inner diving reflex, the inner dolphin, and you activate the vagus nerve going to the rest and digest system. So we use different exercises in breathology to rewire the body, the nervous system, the brain, going from bad habits to good habits, and creating simple exercises and tools, as you mentioned yourself, that are applicable to everyday situations, whether it's patients with severe stress or trauma, like in the case of PTSD, or just more in the stress side of things, or anxiety, fear, even depression. So in general, it's an add-on education you have taken because you're already a nurse, you already have many years of experience. So the Breatheology certification program that you went through was 2 months online, and then the certification 3 days live. At that time, it was in this beautiful conference center and hotel in Vejle in Denmark.
Gorgeous. Mm-hmm.
Gorgeous, yes, it was, even the weather. So I would just curious to know how you've implemented it. Now, it's only been 2 months, so I know, of course, that you have some very interesting stuff to share, and that you have already been approved in your center, as I have understood it, but also other centers are interested. Could you just run through it very briefly, and also the scientific approach, what is planned, and what does the future look like for you and your patients within the next 2 or 3 months?
Okay. What we're planning on doing is incorporating a 6 to 10 week program that we spend a few hours every week to breath training programs. And again, it goes over everything I mentioned earlier as far as stabilization techniques, breathing techniques, specifically like the relaxation, the ability to become aware of your breath and the connection between your breath and your heartbeat, and that's working on that connection and the communication between your respiratory and your nervous system, and just strengthening that relationship for our patients is what's very, very helpful. So we're going to be working on a program. I'm going to be seeing individuals and small groups, as well as doing large lectures for the entire community. And like I said, it's a residential facility, so our patients come and they don't leave for 90 days. So during that time, we take them and we go through the entire process, and we measure how many medications patients come in on and how many they leave on, and we measure how it may help to get a lot deeper sleep. So we measure insomnia, we'll measure depression, anxiety, all these factors that have like a correlation, that PTSD, addiction, these are all the symptoms that are presenting symptoms from those different traumas. So that's what I'm working on, and I'm having more days, and I've added more days to my schedule that I'm able to spend it specifically on breath work, which was my goal beginning when I first signed up for the instructors program. So it's all coming together since that first day I spoke with you on the phone, Stig, and you let me know I was accepted into the program. So it's been a blessing ever since, and the look I see in patients' eyes that actually it's making a difference in their lives, and I can see it happening. It's amazing.
Yeah.
So yeah, it's been wonderful.
Well, thank you so much for sharing. I'm very excited about this work. As you know, and as the whole world should know, we also support PTSD in various ways. I did a TED talk on it recently. Hopefully it'll be released soon. And we're also working with veterans and Navy SEALs directly to help alleviate the challenges and trauma from PTSD. But of course, we're looking at this on a much broader scale as well, on a much broader scope. Not just veterans, it's also people with addiction challenges, people with depression, people with all sorts of challenges in life, and how the breathing techniques, the simple relaxation techniques, the breath holding, which is something new to most people, how all that tie in together in a program that is very, very user-friendly, so to speak. You don't need to be a yoga expert or flexible or super strong. And how that can be used every day, and you can track your progress in so many ways. And that's what you're going to be studying now with this pilot study, and then on a broader scale with the different scientists that are working on it. And hopefully this can spread out to many more centers, and we can get the breathology method into different clinics and hospitals, and eventually, of course, schools and everything else. This is the main goal. And you're doing a fantastic work, and of course we can't wait to welcome you on the Master Instructor Program, the final step in breathology, in the way that you can also go out and teach this to other instructors and
yes.
get a much broader audience, because we really want to get to helping people cutting down on drugs and eventually getting totally free of having to take any drugs, because the drug will never help the root cause. It can dampen the symptoms, but it's of course not going to change the trauma you had, or it's not going to cure it or treat it. It's something that is just kind of alleviating the pain, but it's not going back to the root cause, and it's not changing the nervous system to the better, and it's certainly not rewriting the narrative or the story that you're telling yourself. So all these things combined are unfortunately very important to deal with, and you're doing a fabulous job, and I'm so impressed that you have done this in 2 months. You've gotten the approval, you have your peers signing off on it as well, and you maybe should end off telling what you just told me on the phone before, that today you did your first presentation for 75 people.
That's right. Yeah, I did the presentation for the entire community of our treatment center as a intro to what the breathwork, what the breatheology course could offer, and it was a mandatory structure that everyone needed to attend, and everyone filled out a questionnaire at the end, and 100% of the participants thought that breath control, breatheology would be helpful towards their recovery and the benefits towards their recovery. So it was very positive feedback, and it was exciting to see that many people who kind of came into it not knowing what to expect from all different walks of life, just being able to see the potential benefits that breathwork could bring to them. And I just should mention that, I mean, it's going to make an amazing difference in the patients' lives. I've seen it already. I've seen the looks in their faces, but I should mention staff. There's a lot of clinical staff, and it's a big part of, workplace burnout, and big part of, stressful situations, and just anxiety caused by, the old professional healthcare professionals giving too much. So I'm planning on offering the breathing for all the staff members as well at these treatment centers, and everyone seems to be quite excited about the idea, and looking forward to working.
Fantastic, Tyler. And we'll get it into the hospitals as well. We'll get it into doctors and nurses like yourself.
Got it.
At some point in your life might need this, and it comes in handy to have these techniques as well. So thank you so much for sharing, and I can't wait to see all the success stories and the scientific data pouring in. I know you have very, very broad protocols, and you track so many different parameters. So you really get a lot of data from their background history, drug use, and all sorts of social family backgrounds as well. So it's a very, very broad study. It's not just some little questionnaire, and it's amazing to see. So thank you for sharing, and most importantly, thank you for all the great job you're doing. I mean, this is your life work, your life mission. So keep at it, and keep us in the loop, please, so we can share more good knowledge with, or more good feedback, and some happy case studies from your patients when you take them by the hand and follow them down the line. So we can't wait to hear from you again and share this with the world.
Thank you, Stig. It's great to see you. And yes, let's keep moving forward, one breath at a time.
Exactly. Let's breathe, and happy Canada Day to you folks over there. Bye.
Thanks, guys.